introduce you to Dr. Miguel Moniz. And one more thing, Miguel, before I turn it over to you, sorry, but he's also doing some incredible things in the Portuguese communities in Rhode Island and in Massachusetts from the perspective of reducing stigma. And Miguel is also going to talk about those fascinating programs that I don't know if they've concluded, if they're still going on, but Miguel is going to impart on us lessons learned from what those programs, what was involved in those stigma busting programs on the East Coast. So with that, Miguel, and by the way, it's midnight over there. It's actually more like 12:17, and Miguel is going to be online with us until 1:30 in the morning in Portugal. So Miguel, thank you for that. And it's an honor to host you and Mason Whipple from Michigan State University.
Yes, thank you, Mario. Well, I got my tea here, so I should be all right.
Okay.
If I or Mason nods off, because she's also over here. Okay. Hopefully you can clang a pot or pan and wake us up. Hopefully my talk won't be or my remarks here today won't be so boring that I put myself to sleep, or any of you all, even though it's 7 o'clock there. In any case, I also wanted to quickly say I don't want to sell Mason short with her with the introduction. You know, the way that I really know Mason is through she's right now currently in Portugal as a Fulbright scholar, doing a really important study, you know, on related to her own research, you know, on drug addiction treatment. So you know, she's we met through her time here as a Fulbright scholar. I'm deeply involved with the Fulbright program, and I was eager, you know, to talk more with her about her research on this topic, and I'm eager to also to learn from her when that research gets published, and when she's done with the project. And also thank you to her, because she was really the one that put me in touch with Mario. So what I'm really going to talk about today, I don't know if I can see like some of you in the room, harder to see people online, but maybe you could respond in the chat. Is if any of you know of the Portuguese, what has been going on, if you've heard anything about what's happening in Portugal, or if this is the first you heard it when you saw the flyer. Anybody there? I see a lot of people shaking their heads. Not really.
Well,
okay.
There will be people yeah, responding in the chat feature. And so, yeah, just keep a close eye on that, Miguel.
Yeah, so I see it. Some people say, yeah, not much, a little bit. So I should say that you know, I've come to this from kind of a long road. I was actually, although I've spent the last 20 plus years, actually really going back to the 90s, living in Portugal. I was actually born and grew up in Massachusetts, as well as Rhode Island, although my family is from Portugal itself. Spent much of my life back and forth when I was younger, but I've really been here for quite a long time. And let me just, I'm going to share my slides with you. What I'm really going to try and do is give you kind of an overview of what some of the things that have been happening here in Portugal, and then talk a little bit about efforts in the US and how, what some of the difficulties are in implementing what has been, moreover, quite a globally renowned strategy or policy, a drug policy that Portugal has adopted. Many places, I don't know if you're familiar with what's been going on in Oregon. Oregon, for example, sent around 70 people to Portugal to do interviews and talk to people here about what was going on. The strategy in Norway also is as a result of what's been going on in Portugal, and in other studies as well around the world, including some efforts on the part of the Australian government to respond to their opioid overdose crisis. The U.S., as we know, has been confronting this for some time. Let me just share my slides with you. So I'm going to give you an overview, basically, of what's been going on in Portugal, and hopefully by the time that Mason talks about her work at a safe consumption site, you'll have a little more context for what she will talk about. So without further ado, let me just share my screen with you all. And there we go. And okay, so hopefully you can see, yeah, there it is. Very good. Is that too small? Hopefully that's, I'll make that a little bit bigger for you if that matters.
How's that look, Brandon?
Okay. So, so just to give you some background on my connection to this topic and how I got into this. So I wrote my dissertation right around the time when the policy was adopted in Portugal. So 1999 to 2001 is when I was working on a project about people getting deported from the U.S. and Canada back to the Azores. And I don't know if you remember some of the deportation policies that got enacted in the 90s, but effectively they created a system where pretty much anyone who had ever committed any crime was automatically deportable if they were not a US citizen. This is people who had actually had green cards, except they changed the law at that point by defining an aggravated felony as anyone who'd actually been convicted of a crime for which it was more than 1 year, where the sentence was more than 1 year. So I did work in the Azores over 99 to 2001 with hundreds of these Azorean Portuguese. The Azores is a mid-island archipelago in the middle of the Atlantic, for those of you who don't know, part of a Portuguese autonomous region, but it's effectively a part of Portugal. And most of the immigrants in New England, where I'm from, as well as California, where there's also a lot of immigrants from the Azores, they're actually from these Azorean islands. You can do a quick Google search of them. Quite isolated place, beautiful place, but most of these individuals got deported back to the islands. And what I learned when I was there was that almost every single one of them had been deported. The crime for which that they were deported was related to drug use. So either they themselves were users of drugs and got deported for possession, or they were deported for a crime related to a secondary crime related to drug use, breaking and entering, aggravated assault, some other kinds of criminal offenses like that. In addition to others who were trafficking. So when I was there, is when they actually implemented this Portugal's new drug policy, and I got to see firsthand a little bit of some of the responses to to that drug policy. More recently, however, I've been working on a number of projects. One includes some collaborations with the Center of Biomedical Research Excellence on opioids and overdose at Rhode Island College. Rhode Island Hospital, rather. Which is a really important NIH, Center of Biomedical Research Excellence, looking into this topic, cutting state-of-the-art research, looking also at trying how to create transformative policy and these kinds of things. So Dr. João Goulão, who is the architect of this project that I'm going to tell you about in the Portuguese policy, he came to visit Rhode Island and Massachusetts to the Cobre Center. And the director of the Cobre Center, Dr. Jody Rich, is really doing incredible work himself in Massachusetts and Rhode Island. He invited me as someone with connections to the community to help with his visit, to meet him, talk to him, and also to help bring him into the communities where I was doing some work. This developed a number of other projects that I've been working on that Mario alluded to in the beginning of in my introduction. Trying to work with community organizations to reduce stigma. I'm currently right now the co-PI or co-principal investigator of a project looking specifically at how Portuguese police and their very important role in Portugal's drug policy. And our goal is to try and better understand what happened in Portugal and the Portuguese police's important role. To be able to talk to police in the U.S. My co-PI in that project is Brandon Del Pozo, who is a former police chief. and a former member of the NYPD in the U.S. And he is a leading expert on police responses to opioid policy. He himself was a great innovator when he was chief of police in Vermont.
Hey,
to tell a little bit of my own personal story.
Real quick, Brandon said there's a presentation.
Del Pozo. So yeah, I've had close family members with substance use disorder and opioid use disorder that have been affected by these issues, and so I take these quite personally. And also I have many friends and work with a number of people in the organizations. As you all know, at Washtenaw Fan, this is a problem that affects everyone across class, and across all category of humanness, and it's extremely important for us to, or for me anyway, to be able to connect with some of these community organizations that really are the font of innovation for unique approaches. They're the people that I think are really on the cutting edge and the leading edge of how to really confront this problem head on. So moving on. Some of you who may have heard about Portugal's policy, there's so much misinformation about Portugal's policy. Many people think that it's something that it's absolutely not. So these are some quotes that you sometimes hear. On the one hand, people will say, Portugal made all drugs legal and you can't be arrested for having drugs in Portugal. Portugal normalized drug use. There's all kinds of misconceptions on the one hand about what happened in Portugal, none of which are really true. On the other hand, Portugal sometimes is held up as this progressive bastion of, for policy changes. And it's also not that as well. And what I'm going to kind of try to point out is it's actually was, I think, quite a conservative policy in some ways, although quite innovative. And when people better understand what actually happens here, I think it will make more sense. So first off, just a couple of things of what they did not do for those of you who may have heard of some of these. The drug possession remains illegal. Effectively, actually, let me do this a little out of order. I should, well, basically, what they did was they hold on, let me flip forward here. Yeah. So effectively what Portugal did in the law in 2000 was they changed the law so that consumption, acquisition, possession of drugs for personal use, which is considered up to 10 days, they did not consider it to be a criminal offense. So in other words, they shifted the enforcement of drug policy and from the criminal justice system to jurisdiction under the Ministry of Health. This is a very transformative change in how we think about, the meaning of drug use. Rather than criminalizing users, what you're really doing is decriminalizing the users themselves. You're not just decriminalizing the drugs; you're decriminalizing the people who use drugs. So, this is was a great shift. The other shift that they did was rather than look at laws to punish people who were using drugs, they tried to create a system that helped to dissuade people from using drugs, and then to get them the necessary help that they needed. And we'll talk a little bit about that in a second. But to go back, what it didn't do though was make drug possession legal. Like it's still illegal to have drugs, and in fact there are still criminal penalties for people who are in possession of drugs if it's over a certain amount. Trafficking drugs remains a criminal offense. There's an emphasis here. What did happen though was an emphasis on harm reduction and a shift from conceiving of problematic drug use as a criminal offense to a public health matter. And most importantly though, the Portuguese strategy didn't see decriminalization alone as as the cure-all for the problem, for the opioid crisis in the country. But rather see it as one part of a broader integrated society-wide, broadly networked program of interventions across communities and with multiple community partners and different community shareholders to try and help people who who wanted help from problematic drug use. So what was happening in Portugal that precipitated these dramatic changes? Well, first of all, Portugal, for those of you who don't know, was under about a 50-year dictatorship, a very closed society. And atop of it had been in the midst, as a colonial power, had been in the midst of colonial wars in Africa, which ended in 1974, when effectively the Portuguese, a group of Portuguese junior officers decided they were going to switch sides and overthrow the dictatorship, which they did. In the ensuing decades, with the opening of Portuguese society, with a more or less tolerated drug use among some of the returning people that were coming back from the war, you had a huge increase in cannabis use, and eventually you had a tremendous amount of heroin use as well. So by 1999, as you can see here on the slideshow, around 100,000 people, or around 1% of the population, which is quite extraordinary, 1% of the population had problematic drug use, which was mostly heroin. And this put Portugal at among the highest in Europe. It was across all social classes, and eventually it became a major political concern. And there was efforts to see that something had to be done. So again, the law that got passed and got put into effect in the early 2000s was under the auspices, or the architect of this was Dr. João Goulão, who currently runs Portugal's drug policy. I would actually like to thank him. He's been an extraordinary resource for me, someone who I've interviewed a number of times, and he's provided a tremendous amount of research for my own work, but also specifically for this presentation as well. I have, at the end of the presentation, I'm going to give you all a bibliography with some further reading if you're interested in pursuing more knowledge on this topic. And I really encourage you to see some of Dr. Goulão's talks that he's given on this topic. He's an incredibly warm, charismatic speaker, and he really lays out what happens in Portugal and sort of his philosophy and the philosophy behind the drug strategy. And you really, if you're interested in this topic, you really owe it to yourself to go to the source and see Dr. Goulão talk about it. I have a couple of links that I'm putting into the chat at the end of the talk. So basically what they did was in Portugal, they created 5 pillars that, again, tried to shift drug policy from criminalizing people who were using drugs into a coordinated public health approach that sought to prevent drug use in the first place, that tried to help people get treatment that needed it, that tried to dissuade people from using before they started using, or dissuade them from using once they started, to focus on harm reduction rather than punishments, and to also provide people with the necessary skills, job training, driver's licenses, and these kinds of the sort of practical things that people need, life skills, to be able to reintegrate back into society, or I don't know if I would use the word, that's their use, reintegration, but basically to help them get back on their feet, let's say, from some of the difficulties that problematic drug use might have caused them. So and they created across the country a number of structures for harm reduction, including you can see some of them here: outreach, refugee shelters, contacts, information points. The police actually became a great source of information as well, going into schools, talking to children. They created various levels of treatment and support for people who might who might need it. As part of the harm reduction, there are other there are some other more practical scientific measures that they also instituted that you can read about here. And again, these were all government programs that and the Portuguese government set up centers and worked predominantly, interestingly, with civil society organizations much like Wash Na Fan, but here in Portugal, who were able to administer some of these government programs, or similar to GATT that Mason will talk about shortly as well. That runs the safe consumption site. And there's also drug checking in recreational settings undertaken by another civil society organization, Cosmocare. So Portugal created a number of partnerships with community organizations that I think is also part of what is interesting about Portugal's model. The civil society organizations, as I said, are really innovative sources of support for communities, and to directly involve for the government to directly involve them in these solutions, I think is also an interesting model for the U.S. and one, by the way, that the U.S. is actually quite involved with as well. So so what happens when someone gets caught with or apprehended with drugs? Basically, the police are the front line of the policy, and they effectively determine how much of a given drug the person has. Was it 10 days of use? How much is in their possession? If it's under a certain amount, under the 10-day threshold, a person will be assigned basically a citation where they have to appear in front of one of the commissions, one of the National Drug Strategy Commissions that are distributed throughout the country. Although they are sort of skewed towards urban centers where there's more issues. An individual actually will go there. They actually are not forced to go, although there are escalating sanctions that can take place with someone who doesn't want to go, depending. And there's no one-size-fits-all approach also, that each individual is looked at an individual, and their individual circumstances are also taken into consideration. One, by the commissions that include social workers, they include psychologists, they include people who really are placing the person that got referred to them, the people that were using drugs, really putting them at the center of the intervention, and trying to help them to really accomplish what they want to accomplish. And again, no one is forced to do anything. What it's about is trying to help people to come to their own decisions and provide resources for them so that they can can get help if they want to. And also, what Portugal did was try to take down some of the barriers against people seeking help. One of the biggest problems with criminalization, I think, is that it puts up barriers, and I know that João Goulão will, this is what he believes greatly, is that it puts barriers up against people seeking help. First of all, it stigmatizes people if they're seen as criminals, and secondly, it also practically, just in practical terms, no one's going to go get help if they're going to go to jail for possessing drugs. So what this did was it actually brought down one of the main barriers against people trying to seek help, and we'll see that the results actually were quite positive. So again, and part of this is you can see that in some of these slides I actually took directly from João Goulão's one of João Goulão's presentations. This is from SICAD, the Portuguese agency that is responsible for overseeing Portugal's drug policy and implementing Portugal's drug policy. And you can see, some of the kinds of services and units that they have here, spread throughout all of Portugal. Most of these places where you see the dots are where the larger population centers are in Portugal. And you can see also some of the the network here of support that's provided by Portugal's model, or Portugal's experience. It's really quite comprehensive, as you can see, across all of society. It's not just one piecemeal or a small intervention here with limited funding, and then in 2 years the funding runs out and the program is no longer available. It is a comprehensive program that the government supports, that is ongoing, And all of these organizations also don't exist in a vacuum. There's a national commission with all of these shareholders, and there are district commissions as well with shareholders and across all of these, across all of these categories. And they're constantly communicating with one another. They're evaluating the efficacy of the programs. It's really, like I say, a comprehensive society-wide network of interventions. That's a coordinated and society-wide network of interventions. So some data here, again, this is taken from CICAD and João Goulão from one of his presentations. You can see that this is from 2001 to 2018. There were around 150,000 processes, of which 132 were offenders. These are sort of broken up into non-problematic drug users, problematic drug users. Some are given specialized support. Of those, around 11,000, were brought into these treatment teams and integrated responses. And again, these are people who wanted to participate in these programs. They really genuinely wanted to participate in these programs, and because Portugal created a system in which they would be able to do so, they sought out help. I'm going to turn it over now to Mason, just to jump in here. I think Mario, we did a good job of introducing you in the beginning, so I'm just going to pass it over to you right now to talk about some of the really interesting work that you've been doing at GAT.
Mm-hmm. Okay,
so Mason,
yeah.
just to set the stage, you are literally volunteering at a safe use site in Portugal, correct?
Yes, I'm there every Thursday, so only one time of the week. I'm actually a chemical engineer, so the rest of my time I'm working in the lab.
Okay.
So.
Well, keep going. Sorry for interrupting.
Yeah, no worries. Yeah, so I just wanted to start by saying that GAT, it's not just a safe use site. They have a ton of other services. So that's just one of the things that they have. And I briefly just wanted to go over kind of like how the organization works. So they have like 2 separate rooms. And on one side, it's almost split by buildings, but they're right next door to each other. And on one side, they have more of like a drop-in center. And you can come in, people will come in and they have the distribution of the consumption and safe sex materials. So that's one thing, is people come in, they ask for kits, and the kits include materials for injection. So like syringes, needles, like alcohol, wipes and stuff like that, just to ensure that the people are using safely and to reduce the potential for HIV infection. They have other consumption materials like aluminum foil. People come in asking for that often, but they also have clothes and just like general shampoo, conditioner, lotion, and body soap. They have razors and shaving cream, and people really often come in asking for those materials because most of the people that are using the space are homeless. And then they also have clothes, so people come in, and it's really just a place on that side. People are kind of just hanging out. They also have the social support, so there's like social workers, and they have therapists. So they have like mental health services where you can just come in and leave your name, and then throughout the day, most of the people are just hanging out. So throughout the day, your name gets called. You can talk with someone about your mental health. The peer counseling is something that I think is really interesting. They actually have many people working in the space who were formerly addicted to drugs, and so now they're working in that space, and they're basically just providing support to the people using, and I think it's a really good network that they have, where they can see that these people have overcome their addiction, and that they're working with them to help overcome theirs as well. And they also have nurses. They always have 2 nurses on site, and they typically have at least 1 doctor. So they can go in for anything. So people will come in and they have cuts. People come in for the rapid screening for HIV, hepatitis, and syphilis, of course. And then on the other side is the supervised consumption. And on that side, it basically is just a room, and they have the peers and they have other social workers, just making sure that they're using safely. They're making sure that no one is doing anything dangerous, like messing with each other, and everyone is also trained to recognize overdose symptoms. So in the case that anyone is experiencing overdose or has used too much, they can recognize that right away, and they can but so I was actually there when one happened, and what they did was they just brought the person over to the nurse and the doctors, and they immediately took care of him. They called the ambulance, and they just treated him right there on site. So it's a really interesting system. And that basically covers like the services. And then you can go to the next slide then real quick.
Yeah.
So and then I just wanted to kind of talk about the impacts that I've seen. I've only been there for about 1 month. And like I said, I'm only there once a week, but I've already seen the impact that this has had on this community. And first, basically, when people come in and they're coming in often, they register in the space. So they want to monitor how many kits they're giving out, all of the materials that they're giving out. They want to monitor how many they are. They want to monitor the gender, like just to keep statistics of the space, right? And just in the registered system, since they opened in 2013, they have over 1,300 people. And that includes people who are currently using or people who have used in the past. And since 2000 or in 2022, so in the last year, they've had just about 10 overdoses, which is pretty minor. And they've all been not fatal, and that's due to the immediate intervention by the staff there. And really what I've seen is that this is just providing a really safe, supportive community for these people who may feel otherwise ostracized from society. And I just wanted to give like a small story about that, just about some of the people that I've met in this space. And it was just this past Thursday, I was working, and this couple came in and they were being super friendly. And it's interesting because I can speak a little bit of Portuguese, but my Portuguese isn't that great. And most of these people there speak English anyways. So they were just telling me about their life and telling me about their experiences at GET. And they were pretty early users in the space. And they started going, I would say probably within the maybe in the last 8 years. And when they started going, they originally went there for HIV medicine and treatment. So they go and they start coming to this space pretty often, and becoming like feeling safe, feeling supported in this space. And then they started telling people that they think that the HIV pills have something in them that are making them feel like they don't want to use drugs as often. They don't feel like using anymore. And obviously that's not the case, but I just thought it was really interesting how just because they have this community and this support and they're doing something that's like improving their health, it's making them feel like they don't want to use anymore. And yeah, they still come to the space, and they said that they do still use occasionally, but it's much more rare, and they've improved their lives drastically, as they were telling me. And so that's kind of what I wanted to talk about today. And of course, if you have any questions, I can answer them in the end. So that's it.
We're going to transition
Great, thanks.
back
Thanks
to
so much,
Miguel.
Mason.
Yeah,
Yeah, thanks
there's
so much, Mason.
go
Yeah,
ahead.
I really appreciate that, and this is fascinating. I hope that, I mean, you if you collect a little data, you have a nice little paper on your hands here for this.
Yeah, for sure.
I hope that I hope you're thinking about that. But so one of the things that Mason just talked about was how it creates an environment for people to seek help that want to do that. And you know, the facts really are the proof is in the pudding, as they say. I want to be very clear, though. There's a really interesting study by Stevens and Hughes that I actually put into into our biography, the bibliography at the end, that sort of looks at the way that the Portuguese model was kind of a Rorschach test that you know, people looked at it, and if they were anti-decriminalization, they saw something that they liked, and if they were pro-decriminalization, they saw something that they liked. You know, and the way that the data worked, and you know, there are some parts of the data that, I mean, like in some, you know, cases, overall, for example, more people are more adults are using drugs than they did in the past. I think largely, in part, that's a result of the fact that cannabis use is actually way up in Portugal, or as a percentage of the kinds of drugs that people are using. But the other statistics are actually quite interesting. So overall, there's been a steady decrease of injectable drug use, you know, year by year over the past 12 months. Like, you know, steady drug use over 12 months, you know, as a year by year statistic. There's been a dramatic decrease of HIV infections among drug users overall. And there's been a massive reduction of drug-related deaths. Just to give you an idea, Portugal had in the last year a total of 74 drug-related deaths in 2020, and that was actually quite high, as almost everybody saw during COVID. The amount of overdoses went up pretty much everywhere, and you know, up from, you know, 50 something. So in a population of 10 million. Portugal has about roughly exactly the same population as Michigan, as the state of Michigan. So Portugal had 7.4 per million people. And the state of Michigan, which has 10 million people, had, in the statistic that I saw from state of Michigan Opioid Resources, had 2,800 drug-related fatalities. So that is what, 280 per million. 7.4 versus 280 per million. So, you know, something is going right in Portugal that isn't happening in other places. And then, you know, as I said, I kind of alluded to this before, that you know, you flipped also, so that instead of in 2010. You had, you know, half of the people using drugs were, you know, or comprising new drug use were taking heroin. Cannabis was only 26, and now that's flipped. So new drug users are only 21%, and cannabis is 53. So that's, you know, that's a significant transformation there.
Miguel, do you know why that is? Why that kind of flipped? Is there any?
I don't. I mean, sometimes I have questions in my head. I wish that João Goulart was around to be able to ask some of these questions too, because he really knows everything. But you know, about this topic. But I think that there's probably a number of factors. I think definitely that the policy has worked. I think that some of the prevention work that Portugal has been doing. You know, for example, new drug users that are young, the use is down overall. So, you know, this is having an effect, I think, later on. I think that's, you know, that's part of it. I think that as, you know, marijuana use is more prevalent and easier, and people aren't getting charged with it, it becomes much like alcohol, where people just, you know, are doing more cannabis. But I don't know. I don't know the answer. I don't want to hazard. And
No, it's okay.
My greatest fear is always.
Sorry for interrupting.
Is always, you know, providing opinions on things that I'm ignorant about. So I'm going to pass on that one. And maybe I can try and get an answer for you later on, Mario, if you would be patient. So as you can see, there's small increases on illicit drug use among adults. This actually comes directly from CICAD and João Goulão. There's been a reduction in delay in experimentation among adolescents, down. Reduction of injection drug use, down. Reduction of opioid-related deaths and infectious diseases overall as a trend since 2001. Of course, COVID really, these statistics came right before COVID, as you can see. A reduced number of drug offenders on the criminal justice system, and that's odd for obvious reasons, if it's been decriminalized. Reduced stigma of drug use, and part of that is some of the things that we've talked about, and I'm going to get into this in the last sort of, I guess, 15 minutes or so of my discussion. And importantly, for policymakers, and this is kind of a good segue into the next part of our talk. There was a drop in the ranking of drugs as a social and political, in social and political debates. So it became a way less important issue in Portugal, from one of the key issues in Portugal to one of the minor ones. So as we can see, this policy has really worked. When analyzed closely, I would argue that Portugal's approach was actually quite cautious and conservative, and certainly at times contradictory. It's not a model of decriminalization, it's actually a hybrid model of decriminalization and penalization. Some people think this is much better. Other people think that this is a very bad idea. One of the articles that I'm putting in by Rigo et al. Is a fantastic article I would encourage you to read, that sort of lays out what I think are some very interesting arguments about how having a hybrid model of decriminalization and penalization actually does not take away stigma. It actually increases, it creates conditions for which stigma can persist. And this is something I think that is quite an interesting study if you want to take a look at it. But nonetheless, I think that the model, although it seems, I've even heard, one of the Portuguese newspapers once referred to it as Portugal's radical drug model. And I talked to the editor of the paper, and I said, what prompted you to say that it was radical? And and she sort of said some things, but after we talked a little while, after she sort of actually heard João Goulão talk, she realized it's not really a radical, drug policy at all. It's actually quite a conservative, cautious, and considered policy. And really, this shift. The important thing here is, we've kind of talked about some of the specifics, and obviously people can come to Portugal and study the specifics with SCAD. But what in broader terms, what really happened was that by decriminalizing drugs, we not only decriminalized, or Portugal not only decriminalized drug use, it also decriminalized the people who were using the drugs, And this has a tremendous impact, as we've talked about throughout this talk, both Nathan and I, on people and how they have been able to respond to and seek treatment. Also Portugal is, if people don't want to seek treatment and want to continue to. I saw in the chat. I'll say it now because it's an important point to bring up. People ask what problematic drug use is, and this is actually, there are complex methodologies by which, the commissions are able to gauge what problematic drug use but effectively, it is long-term drug use that leads to psychological problems, legal problems, financial problems, health problems. This is considered to be problematic drug use. And you can see where libertarians might think that, again, the Portuguese model is good because it allows people to make their own personal choices about whether they want to seek treatment, or not. But ultimately, there are resources there for people who do want to seek treatment. And again, because of the emphasis on harm reduction, there are few people dying from overdose as a result of that. So a big question that gets asked frequently, and I had a conversation recently with the commissioner of the Portuguese police, who is responsible for for the Portuguese police in Lisbon. He serves on the commission, the district commission, and also is involved in national Portuguese policy, representing the police perspective and what the police are doing to participate in strategy rather. And he said that oftentimes he gets interviewed by people from around the world who want to know about the Portuguese experience, and they say, is the Portuguese experience applicable to Australia? Can we replicate it? And I think that, and he also said, and his answer to them always is, I don't know. And the reason, he doesn't know is because each nation has a very unique environment. And I kind of have thought about this a little bit, and I've kind of created a little chart here of some of the ways in which the Portuguese system differs from the US that might create obstacles to implementation. Or at least need to be considered in trying to create an interface for some of the things that Portugal's done. If the U.S. federal government or states or municipal governments would like to try and replicate some of the successes of Portugal. And I'm just going to go through these one by one very quickly in the next 15 minutes. So the implementation context is kind of complicated. Portugal implemented their drug policy in the midst of a very transformative moment in Portuguese history. It had recently joined the European Economic Community, which would eventually be integrated into the EU in 2000s. It was emerging out of a dictatorship, a 50-year dictatorship, and was reestablishing democratic institutions. And it was a great cultural moment of innovation in Portugal, and I think that people were quite receptive to new ideas. It was almost a cultural moment like the end of the Vietnam War, or the very brief moment of Black Lives Matter, when some of the more optimistic people thought that real transformation was going to take place. There was a palpable cultural movement in the air to try and create a new policy. And this is something that I think is unique to Portugal. So we'll move on to demographics and structural features. For example, I also think that Portugal's size also plays a role in this. Like I said, Portugal has the same population as Michigan. It's got a small area. Also, the area of, it would be a small state. It would fall like between Maine and Indiana in terms of area compared to the U.S. And with these kinds of conditions, I think that Portugal had a much easier. It's much easier to implement national policy. Further, Michigan has way more money though than Portugal. If you look at the GDP, Portugal's as a whole country has half of the GDP. A little more than half of the GDP of the state of Michigan. So, that's also an interesting data point when we think of funding priorities for the problems that we have in our societies about, how governments, the kind of resources that they want to apply to solve societal problems. Portugal was able to do this actually on a much smaller budget than Michigan has. Another, I think, important difference, and potentially an obstacle in implementing what Portugal is able to do, is the differences between the governmental systems in each country. Of course, Portugal has a parliamentary system. The US government has representative democracy. How this plays out is that an entire party can create a cultural program or gets together and creates a policy change. And the individual members are insulated from, they're generally insulated from how a national party is going to create a policy. So even if we create a policy and my party, for example, loses the next parliamentary election, I may still be able to keep my seat depending on how many seats we may or may not lose my party. So there's a tremendous amount of stability in the government who's representing it, and are insulated in some ways from quick shifts in the political winds. And this, I think, in some ways allows for, Portugal to have taken a riskier approach to drug policy than I think in some ways is possible in the US. Further, the Portuguese laws are all federal. There's overlapping sets of laws in the US. You have federal law, state law, municipal law. In Portugal, there's basically one, although municipalities also have a political system in place. Local smaller units and localities in Portugal have smaller systems, but most of the policies are created on a nation, at the level of the nation, and everybody is subjected to them. You don't have a system in Portugal, for example, where the cannabis is one example where you have a federal policy where cannabis is illegal. But the states are, innovating and creating this experimental moment in the U.S. with cannabis legalization. But there's all kinds of problems in the law, like people who are starting cannabis, facilities can't get bank loans because it's technically illegal at the federal level. If an administration changes, it's all, everything transforms. Likewise, and this takes place within some of the innovative programs that I know that have been taking place in law enforcement. This is the case. There's some reticence. The law is the law, and it's hard for them to be terribly experimental or innovative when there isn't a law backing up what they're doing. And so some of the there are significant political problems that I think exist. That provide a large obstacle towards transformations in in the U.S. There are some other related criminal issue or political issues here too that I would highlight. One is the way that drug policy is often used as a wedge issue, and this is sort of related to the insulation that I said that can exist in Portugal's party system. There's sometimes not a very one-to-one relationship between evidence-based responses to social problems and policy in a number of US states. This isn't necessarily the case in Michigan, but in a lot of places in the US, it certainly is. Definitely not the case in in Massachusetts and Rhode Island as well, where I do work. And as I mentioned before, the US policymakers, I think, are subject to more volatile individual elections, where political risks that they might take can cause them to very easily lose their seats. The healthcare system is another difference that I think is important to bring up. Portugal has a two-tiered medical system. There's a private insurance that people can get, but there is a robust nationalized medicine. All of these programs that are paid for by the Portuguese budget, annually, even if they are run by civil society organizations, the budget comes from the federal government, and they are willing to back up. Their drug strategy comes with financial backing as well, not just with lofty goals. And in the U.S., the lack of universal health care, I think, can be a problem. The lack of public health funds. Even not from a philosophical point of view of whether you believe in public health or not, but from a management and logistics point of view, it's complicated because you need to get private insurers to participate in in some of the treatment programs that people have, and in often cases in U.S. states, you'll have a situation. I know this is true in Massachusetts. There'll be a great program that's instituted by a civil society organization. And unfortunately, they run out of money, or the insurance doesn't cover, more than X number of months of the program. And and this is, of course, a great tragedy, because someone might be getting help, and then all of a sudden they're not eligible for funds to continue that, to continue those programs, to continue those treatments. So this is another issue. Law enforcement in the courts, and this is I think a really important point, and a very, very important point to bring up, or a factor. And that is this is based on some of my own research and work with law enforcement both in the U.S. And also my work beginning this project that we've begun in Portugal with Brandon Del Pozo and our in our project here. is that the regulatory environment in Portugal and also the sort of the civil society role of what police forces do in Portugal is quite different in the US. Law enforcement, first of all, in my hometown, and one of the videos that I put up is a program that I had to try and address some of these problems by creating community shareholders in Massachusetts. There's a video to that, one of the programs that we had, and you can see some of the police officers in Falmouth, Massachusetts, talk about some of these issues, how they try to innovate, but at the end of the day, it's the law is the law. And no matter, given the discretion that a lot of police have to create innovative approaches, and by the way, this is happening in police departments across the United States. But nonetheless, there is some reluctance on the part of police in the U.S. to embrace this. And there's different opinions among different, police officers in the U.S. Although this was the case when Portugal first implemented these policies, today that's not the case. Police understand what the policy is; they understand what their role is in terms of drug enforcement. Another issue is how arresting people for petty drug possessions can be worked up the chain to create larger arrests. And this is another obstacle, I think, in a lot of police departments. To hear many policemen talk about it. This is an obstacle to their willingness to decriminalize or to support decriminalization. And one thing that's very important to highlight is the police were deeply involved and remain deeply involved with how Portugal manages its drug strategy. And a lot of times, I think police are left out of the conversation in the U.S. Because they're going to be seen as against decriminalization. Well, my personal opinion is there is not going to be any drug reform in the U.S. that doesn't include police, and doesn't include the courts, and doesn't include, talking to and trying to convince people who are not necessarily proponents of drug decriminalization. And this is a very, very important thing that the U.S. as it looks towards these reforms, they have to include police in the conversation. My belief, and most police that in the conversations that I've had with police, they all realize that what is being done is not really working. That arresting people is not working. They're arresting the same people over and over. Those people are ending up in jail, or they're ending up overdosing, or they're ending up again and again getting pursued by police. Police could be spending a lot more time doing other, participating in other or pursuing other important societal work besides a sort of revolving door. And many police themselves realize that something's not working. So police and law enforcement really need to be taken into consideration in the U.S. They're incredibly important partners.
Hey, Miguel, for all those reasons, plus the disease affects people they care about too.
Absolutely, including some police, right? So this is absolutely true, Mario. Absolutely true. So to wrap up, I have like a couple more slides here to share with you. Another important issue is about the stigma of drug use and drugs in society. Decriminalization, and this is a major takeaway, I think, from Portugal. And again, I want to bring up the Rigo et al. Paper that you should all take a look at, that really problematizes and criticizes this notion that Portugal has eliminated the stigma by decriminalizing, because it's pointed, as they point out rightly, Portugal has not entirely decriminalized drug use. But nonetheless, they have significantly shifted the emphasis from criminalizing drug use to turning it into a public health issue. The drug strategy is undertaken under the Ministry of Health. Most of it is anyway. This is a tremendous societal shift that has done a great deal to get people to think differently about what it means to use drugs. In the U.S., we think of drug use as a crime, or it's been historically related to morality issues, senses of failure, projections of individual, lack of self-worth. And I think what decriminalizing does, it starts to shift that perception of people. It starts to change the way that that people think about drug use and think about the people that are using drugs rather than seeing them as somehow failed human beings. They see that people are seeing and understanding, of the medical pathology of substance use disorder and opioid use disorder. And I think that this has greatly transformed in Portugal. It's something that the US, I think, needs to go a long way to do. In the beginning, I said that we're going to talk about civil society organizations, and here we are back again. Much of my work has been, that Mario talked about, has been in trying to involve civil society organizations, mostly working with ethnic Portuguese community civil society organizations. Civil society organizations, and this includes, Washnafan, who are directly involved with responses to the opioid crisis. Other organizations are just community organizations like Portuguese ethnic and Cape Verdean, for example, two that I work with, ethnic organizations. These are organizations that are extremely important in being able to influence local communities and change the stigma. First of all, civil society organizations have an important respected community role, similar to churches, police, fire department, etc., and are already important resources for innovative practices. These organizations also tend to have a prominent political role. Some of them are very involved in politics, or people in the organizations are also involved in politics. People in the organizations are, work for the police, and helping. And again, as Mario said, they all also have family members who have been greatly affected by, by the opioid crisis. So in some ways they're political, but they're ultimately depoliticized, the organizations, because they're public good organizations that are trying to help people. And I think that politicians tend to listen to these kinds of organizations. If politicians feel that they have the support of these kind of organizations, also I feel they would be more willing to, or their risk taking would be a lot less risky. And this is extremely important. So one final word, and then we'll turn it over to questions, that I want to state, is that there really needs to be community-wide buy-in. What Portugal has done is created a broad societal, a transformative, broadly societal network of integrated services, and this has been, I think, the key to Portugal's success. In the US, I think a lot of the solutions are very isolated. There's not an integrated program. There's a tremendous innovation in the US. There are many brilliant people, both in medicine, brilliant people in community outreach, brilliant people, trying to create innovative. I mean, like I see some of the work that goes through and that's being done at the Cobre, and just some of the people at Cobre Center in Rhode Island. Being aware of some of the research that's done and some of the innovative programs that people are doing, it puts me in awe. But there is yet to be kind of a comprehensive government-wide sort of embracing of some kind of a broad approach, with the exception of Oregon, which I think, again, Oregon I think that we don't really have we have limited data right now from Oregon to really understand what's happening there yet. But I'm looking forward to reading more and more studies about what's happening, what's happening with Oregon's experimentation, or innovation rather. But I think that also for those 5 pillars that we talk about in Portugal: prevention, treatment, dissuasion, harm reduction, and integration. I think these are all things that our organizations are doing and are trying to address, and are trying to think about, but as we move forward, it's very important to create these kind of community-wide buy-in, community partnerships. And one of the videos that you may want to take a look at was a conference that was put together between a number of community organizations in Falmouth with the Cobre Center and Dr. João Goulão, to look at to look at the Portuguese model, to look at what was happening in a sort of a snapshot of what's going on in Falmouth. Falmouth is actually my hometown, and I don't know if any of you have ever seen the HBO documentary called Heroin USA, but that was actually largely about Falmouth, my hometown. It's had a tremendous opioid crisis, probably been a massive part of the opioid crisis in the US. really an epicenter or a hot center for the opioid crisis. It's a small rural place, but nonetheless, we tried to create a program of community partners to talk about this issue, and that model was actually quite successful to the point where we're redoing a similar model, working to put one on in June in Massachusetts that will be more statewide, and to try and talk about some of these issues. So, you know, but it only can take place with the buy-in from, you know, disparate political partners. You need to get people on both sides of the issue. You need law enforcement, you need community organizations, and you have to get all these people talking together. And I think that, you know, that this is one way that we can start to really think about, you know, a broader response, and can start to approach some of Portugal's success. So I'll stop there. I see there's a lot of questions. I don't know how much time we have left, but I'm very happy.
Well, we're gonna, along the lines of questions, so everybody hang in there. We're gonna try to get to most, if not all, but yeah, as you can imagine, there are a ton of questions. And if we go a little bit past 8:30, everybody hang in there who wants to hear Miguel and Mason answer their questions. If you need to sign off at 8:30, go ahead. But Miguel, I know you can see, starting from the bottom up, some of these, I'll just read this.
So the first ones are from the bottom, yeah?
Yeah, well, those are the most recently sent. But just go ahead and start with that one.
So I'll read it, and then I'll try and answer it as I can. So the first ones are from the bottom, and then so I should start from the bottom and go. You
should actually scroll.
So okay, so how are mothers and fathers protected from having their children removed from their care if they go to treatment?
Yes.
That's a great question. But in fact, there are two things to think about. One is no one needs to go into care if they don't want to. No one's forced to go into treatment or care. And secondly, I'm not really sure about that. My feeling is that given some cultural disparities that actually some of you have talked about here in these questions, you know, I think that probably family members would take care of children. But I'm certain that, and I don't know this for true, I can look this up and get back to Mario on you on it, but I'm certain that Portugal would have some provision for children to be taken care of. But most definitely, I would imagine that family members would take care of children, given that, you know, given other Portuguese contexts, I would imagine that family members would take care of them. David Gordon, this is great. I'm just actually going to read it because you have, this is a really insightful comment that you have here. He says the earlier statistic for Portugal SUD 1% peaking in the late 90s was characterized as very high relative to other countries in Europe at that time. True. However, relative to US, this is quite low both then and now as a baseline. Realizing two things. First, that the population and socioeconomic variables are very different than the US. You have 1/35 of the population. Such a comparison and applicability is very difficult to say the least. Exactly. As I tried to point out. Second, defining SUD can range in definition from including caffeine and nicotine for a larger rate to only measuring severe opioid statistics for a much smaller number. Both of these factors make it very difficult to extrapolate one to the other. True, although in Portugal, I would note that in the beginning stages, that 1% was almost entirely heroin users. Furthermore, the ramp up in the US, yeah, this is also quite insightful, in the US being triggered by the egregious and heinous medical social crime of fraudulently pushing prescription opiate use on prescribers and patients with chronic pain caused an explosion of misuse not really seen elsewhere. And that's absolutely true, very different from the Portuguese situation. My question is, with all these vast discrepancies, not including other cultural factors, how confident can we be about the validity of these policies as applied to a very different group here in the US? Well, I think when this question was asked was before really I started to try and compare and think about Portugal and the US. Some of these things I think that I tried to address. But yeah, I mean, again, like Comissário Cruz told me, we don't really know, that there are so many variables at play that we can't really talk about, we can't really talk about some of these specifics. What I think we can do, however, is to look at how some of these approaches in decriminalization opened up the ability of people to seek treatment. And I think that we could all agree that it's better for people who need and want treatment to be able to get treatment. Provided that that's evidence-based, efficacious, efficacious treatment. And again, whatever that treatment is, that in general, that is something that's more beneficial than harmful. And if we start with that very simple assumption, then I think that what Portugal has done actually does provide, a roadmap in some ways. Certainly not a model. People sometimes talk about Portugal being a model. I would never say that. Certainly, CICAD and João Galão does not talk about it as a model. I prefer, as they do, to refer to it as an experience. And again, some of these experiences may be applicable or not. So this is part of it. So moving on a controversial topic and question at the heart of this, specifically an apparent conflict between harm reduction and sobriety. It is concerning that in language sobriety is not even mentioned. Well, sobriety, again, I would personally say sobriety is a choice, and it wasn't mentioned because in the Portuguese drug experience, sobriety is up to the individual user or not. I didn't. It wasn't excised as a point or a conscious decision. People that choose to be, that choose to take a path of sobriety, most certainly, can and should take that path if that's what works for them. That doesn't work for everyone, however, and certainly in the Portuguese example, I've heard Galão actually say that he doesn't really care what the model is. I was at in the Falmouth Forum, for example, when he was speaking, someone brought up Alcoholics Anonymous and talked about abstention, and he said, belief in a higher power, and whether this was efficacious or not in the Portuguese model, and what he said, or the Portuguese experience, and what he said was, it doesn't matter. It doesn't really matter what your approach is. It's an individual approach. If one thing works for an individual, then it works for an individual, and if it doesn't work for an individual, then they can pursue another path. I'm certainly not speaking. I'm not a clinician. I'm not an epidemiologist. I'm not a medical researcher that looks at pathways and these kinds of things. Mason, maybe this is something you can address, better, certainly better than I could. But in that case, in the Portuguese experience, I would say that it's an individualized approach that that really is about, if it works, it works for you, it works.
Miguel,
Mason, did you want to add?
Yeah, Mason, did you want to add anything?
I mean, yeah.
Yeah, I can add. I think, I agree with you that I think, of course, sobriety is the end goal in most cases. I think that's what most people are hoping for these people. But if they don't want that for themselves, then they're really just providing the community and the resources for them. And if they come to that conclusion themselves and that's what they want, then they can do it, and they have the resources available to them.
Sure.
And so, I think in the Portuguese experience, it's not so explicit on abstinence and sobriety as it is when we talk about it. So I think it's also different because, just to address a few of the questions as well while I'm at it, they don't have fentanyl here. And so at least when I was just talking with a drug checking organization, they said that they've never in the history of their organization found fentanyl in any drug sample that has been submitted. And I think that changes the conversation surrounding abstinence a lot, because when you're consuming the drug fentanyl, it's obviously so much more dangerous than anything else. it would even be dangerous in a safe use site, you know. So I think that just completely changes the conversation in the US, and so it's kind of hard to compare in that case.
Yeah. And again, I would say that you know, to answer this last question of on the list here about you know, users versus misusers and trafficking. I disagree with the supposition that that all people who are users are traffickers. I think that that isn't. I don't know. I don't know what statistic that's being drawn from, but it certainly hasn't been my observation. In the Portuguese case, they actually have some discretion. The police and the courts have some discretion to determine whether or not a person, you know, what level of trafficker a person, you know, was. Were they, you know, maybe holding for someone else? You know, were they hybrid kind of users, traffickers? These are people that actually get put into the legal criminal justice system, not in the treatment track. And these are people that you know, that will actually have to go to a court case, and it's then determined whether or not they are, you know, there's discretion to determine, you know, what level of trafficker they are or not. So it's actually well thought out in Portugal, and I think you know, and I think addressed in the policy. Although again, it does address this issue of, you know, this is one of the issues where Portugal has a hybrid system where it's both decriminalized and criminalized at the same time. There's some questions here also, Mason, I think that you can answer about GAT in the chat. One is it illegal to have drugs in general? And again, very quickly, it is not. If you have personal use, although drug use is illegal, although buying drugs is illegal, although you know, trafficking drugs is illegal, although giving drugs to someone is illegal, if you have a personal amount for personal use, then you will not, you know, you won't be put up to a criminal sanction. You will go to a, you know, you will go to a you know, for a hearing with a commission to talk about your use. So, but then there's a question here to follow up on that: is, are these GAT communities also illegal? And go ahead and answer that question, Mason. I'll let you take out the rest of that.
Yeah, so I would say no. I think that so they are, I think, funded by the government, and
Yes.
There's no like transfer of drugs in the facilities. I mean, there could be from users, but that's not something that they're doing themselves. And yeah, it is like dependent on each individual person, and so yeah, no, they're not illegal. But I can answer the question before that as well.
Let me just quickly, because I want to add on to what you just said, Mason. So the original 2000 law decided or made a provision saying that there should be some look into drug checking and safe consumption sites. This was not really implemented until the last couple of years. However, I believe that GAT was the first to have a mobile sort of consumption help center. And now there are two safe consumption sites in Portugal, in the two largest urban areas of the country, in Porto and in Lisbon. So yeah, Mason, you're gonna keep going.
Yeah, just for the other question, did they bring their own drugs to the safe use centers? How is fentanyl kept out? And yeah, just they do bring their own drugs. And how is fentanyl kept out? Yeah, like they haven't found any fentanyl. I don't know. I was really surprised by that, actually. At least in the drug checking that they do, they haven't found any. And I think something else to mention that they work kind of in tandem with the drug checking facility. They don't really take the users' drugs and check them for them, but they're always giving them that resource that they can go check their drugs and make sure what they're using is really what they think they're using, and so that they can really be as safe as possible about it.
Yeah, so there's a civil society organization called Cosmic Care that actually has been mostly doing drug checking at at like festivals, music festivals, and these kinds of things. And so there has been some they just started recently doing some limited amounts of drug checking.
Hey, Miguel and Mason, we've got people who came live who want to ask questions.
Oh,
and
absolutely.
I want to get to them too, but this question that came up an hour ago from an anonymous attendee, do you think that reducing stigma involves not looking at drugs or narcotics as the problem, but rather focusing on social issues like socioeconomic disparity, lack of access to quality medical care, lack of access to quality treatment programs, etc.? I promised that I would pose that to you. I don't know if you
Yeah,
can
I mean,
I
think it's all related, right? I mean, I think that certainly if someone is facing problematic use of drugs or narcotics, then that's obviously an issue. But in terms of stigma, yeah, I mean, I think that you can't really separate a lot of, why was powder cocaine given different penalties from crack cocaine? Why was cannabis considered illegal, alcohol not? Why was alcohol considered illegal at certain points in U.S. history? So I mean, like, determinations over what kinds of people are using what kinds of drugs often is related to how they're criminalized or not. So yes, in fact, I think that this is a great question and gets to the heart of several issues about drug use in society.
But before we go to the audience, somebody wanted to know your thoughts on, I don't know if I'm pronouncing it correctly, psilocybin, Miguel, or
yeah.
Well,
yeah, I mean, I won't speak for myself personally, but I can speak for Portugal's policies. That one of the interesting things that Portugal did is that this whole idea of a Class A substance and all and different classifying hard drugs versus softer drugs was something that this policy actually did away with. They sort of treated all the drugs equally, and what made it similar was the 10 days of use or not. Like, do you have 10 days of supply or not? So in the Portuguese policy, all drugs, including hallucinogens and the like, are again considered similarly. It's about 10 days of use. It's about whether the use is problematic or not. It's about whether or not you want to get help or assistance from however, whatever you're going through and dealing with the drug use.
And the comment was it was decriminalized in Ann Arbor, which just FYI. So
okay.
We have one person next door who's been waiting patiently, and just to state for the record, thank you so much for all of you next door for coming and participating live. Jermaine, whoever has that question for Miguel and Mason or Mason, go ahead and have them ask it.
Hello, my name is Kira, and I have a question. So for pregnant women, there is pregnant women that are addicted to drugs. Do you deny people's help? Or I just have that kind of question, like, would you deny their help because they are pregnant, or what would you do in like a situation like that?
Yeah, that's Mason, have pregnant people come into the into the centers? I don't know the answer to that question. That's a really brilliant question.
Yeah, that's a really good question. I have not seen any pregnant people come in since I've been there. I can ask them what they do in that situation and get back to you.
Thank you.
Because if you want to like share your email or some way I can contact you, because I'm not sure what they would do. I mean, they have nurses and they have doctors on site. So I think in that case, they maybe would just provide other services to that person and probably advise them not to use drugs. But
It's
yeah,
just,
no, I can ask. Yeah.
it's like I've seen it really common actually through addiction, especially over here. There's because like my mom, she overdosed on heroin when I was 11, but also used heroin while I was in her stomach. So for me, it's a very big part in my story. So I was just wondering, but thank you for answering as best as you could. Thank you.
You know, we will, Mason, if you would be so kind as to ask someone
Yeah.
what happens if someone pregnant walks into one of your sites in Portugal, what the response is, and then I'll let, I actually know the person that asked that question, and I'll make sure I circle back. Is there anybody else in the conference room who has a question?
I don't think we have any more questions from the people in the conference room.
Okay, so
thanks.
I'm going to send. I can't, for some reason I can't seem to put this into the chat. But Mario, I just sent you a list of bibliography and some videos, especially a video of João Goulão talking. That a couple of videos of João for you all to look at. You know, hopefully those are. I guarantee those will be more informative than anything that I've talked about today. So
I'll make sure, and just so everybody knows, this is being recorded, edited. We're going to get a copy of this out to everyone. It'll be published on our website and will be a part of our email blast that goes out twice a month. So, you know, don't worry about that part of it in terms of taking notes or anything. Real quick, Miguel, Portugal mushrooms status. Somebody asked that question.
Yeah, I think I answered. I think I answered.
Oh,
that
I'm
question.
sorry. Okay, you did. All right. I think.
So Mario, can you check your email very quickly and put the before we close so that people can get the list of bibliography and the links to the videos, because I can't seem to post anything into the chat. I don't know what my issue is. If you open your email, I just copy and paste that into the chat if you would, please. And I put a link to my website if anybody wants to get in touch with me and ask any questions specifically. You can use the link on my personal website.
Awesome. Angela, if you would just respond in the chat, I forwarded you Miguel's email with all that good information.
Yeah, but could you, Mario, is it possible for you to also put it into the chat? Can that be pasted into the chat?
Angela, that's what I'm asking Angela to do.
Okay.
I'm like,
let me see if I can. I might be able to actually put the document into the chat as well.
You're talking to the worst Zoom user in the United States, Miguel.
Okay.
So that's above my pay grade.
Let me try to do it this way then.
No, she's working on it right now, and she's really good at it. So she's good at everything. But Angela will figure this out. So everybody, remember to fill out the survey. I think we've done a pretty good job of answering these questions. And just to wrap things up, pay close attention to our email/newsletter blast that goes out twice a month for the next meeting. It's going to be on site at the University of Michigan. So we're piggybacking off of U of M. It's the next meeting in May, as I mentioned, is not going to be the second week of the second Monday in May. And it's going to revolve around how to best appropriate the opioid settlement funds coming in from the perspective of a Lancet commission. And the meeting's being hosted by Dr. Amy Bonner from the University of Michigan. And I think she's public health epidemiologist. I don't know if Amy's an epidemiologist, but she was on this Lancet commission and is bringing in a colleague from Stanford University to talk about that subject, Dr. Humphreys. So be looking for that. And just before we close out, Mason and Miguel, you guys are awesome. Angela, did you figure out? Let me look at.
No, I uploaded it. If everybody looks, I uploaded it to everyone. It's a biblio for talk.
Okay. Well, here's the other
so if you want to click and open it yourself, or download this, you know, that's you can totally do that.
Well, what we're gonna do, just to make sure is a safety net, in the email blast that goes out twice a month, I'll make sure that everything you just sent is within the body of the email, Miguel. So everybody, and it won't just be the people who are participating here tonight, that'll be for everybody 2,000 strong on our listserv. Okay, so everybody will have access to that.
That's great. And then
go ahead.
And you all here, people are asking me to I'm getting a bunch of emails or emails from people but again, I left my email here, or my website. So if you're interested in reaching out to me, please write me at that. Go to the contacts on my website, and I will very happily. I'm very good about answering people back, and I'm very happy to continue this conversation with anybody that wants to have it, provide more information, answer any questions that we might have gotten to, or just to continue the discussion. So I have again, just go to my website. I put the link here. It's miguelmuniz.com. So I look forward to talking to you all about it. And if I could just also say thank you, Mario, thank you, Mason. Really appreciated the chance here to get to talk to you all in Ann Arbor about this really important issue, and thank you all for all of your great work on this topic as well.
Hey, Mason, thank you for making the connection. Okay,
Yeah.
and thank you for caring the way that you do. Okay, that's evident, and just from the first time I met you, and you hooked me up with a winner over here. So look, thank you so much, you guys. Thank you to everyone who participated, and we'll see everybody next month on campus at the University of Michigan. Take care, everybody. Bye-bye.